Good morning. How are you doing today? I'm wonderful, thank you. And you've been here before, correct? Okay. Yeah, I thought I remembered you. And you personally requested a new cranial nerve exam. Yeah, I see you did have one in the past. So did you hit your head, have any accident? No, you just find they're relaxing. Okay. Well, that's the first time I've heard that before, but no problem. I can definitely give you the exam today. And can you just confirm your date of birth? Perfect. And then no symptoms of cognitive impairment. Okay, yeah, so that would be memory loss, dizziness, sometimes head pain, head trauma, any other changes in health. Okay, so generally you're very healthy. Okay, good. Any prescribed medication? Okay. How often do you take that? Who is your family doctor? Perfect. Alright, so I think we can get started. So anybody who has a cranial nerve disorder may suffer from intense pain, vertigo is a common symptom, hearing loss, weakness, sometimes paralysis. There's a lot of symptoms that can come up with the cranial nerve issues. And these disorders can also affect your senses, so taste, smell, touch, swallowing, muscles in your neck, things like that. So we're going to test most of those things today, okay? So let's start off with sense. So I have 4 different scents here. And I'm going to hold one at a time up to your nostrils. So first, just hold your right nostril like this for me. And I'm going to have you alternate back and forth. So here is the first scent. Can you tell me what that is? Very good. Strawberries. Now let's get the next one. And we'll have you hold the same nostril again. So your right one. Here it is. Do you know what that is? Very good. Yep. Banana. See if I can get a trickier one here. Let's see what this is. Let's do this one. Alright, so now hold your left nostril. What about this one? Yes, very good. So yeah, that's just a general flower scent. So it should just smell very floral. And let's do this as the last one. What do you smell with this one? Very good. Coffee. And have you lost your sense of smell in the past few years? Not at all. Okay, good. Well, let's move on to taste next. So, very similar. I just have a few different taste drops. So I'm just going to drop it on your tongue, and you're not allergic to anything. Okay, good. So it'll just dissolve, and then you can tell me what the taste is. Alright, so open wide. Very good. Okay. Do you know what that one is? Yeah. Bubblegum. Definitely a favorite. Let's do this one. And have you lost your sense of taste at all recently? Okay. Alright, so open up again. Good. And what is that one? Very, very good. That is peppermint. So no issues with those two senses. Good. Now let's move on to your hearing. So any issues with hearing, any pain? What about any history of ear infections? Okay, good. So I'm going to have you close your eyes if you don't mind. I'm just going to whisper some numbers in your ears, your right side and your left side. Just repeat back the numbers for me. Okay? So just close your eyes and let me know what numbers you hear. Okay? 22, 19, 31. Very good. 18, 77, 89. Good. 200, 44, 7. Good. And just one more. 17, 62, 32. Good. Okay. So no issues hearing any of those. Yeah, you didn't struggle at all, which was good. Let's see what's next. Okay. So close your eyes one more time. Just let me know if this sound is up close next to your ears or further away. Okay? Yep. So the first was up close. The second was further away. Good. Now let's try again. What about that time? Exactly. Very good. So the first was further away. The second was close up. And you get your ears cleaned. Okay. Alright. So let's take a look at your eyes next. So I'm going to cover one of your eyes and then have you focus on a light that I will be flashing. Okay? So let's start with covering your right eye. Just like that. Okay, now just focus right back here for me. And now just follow the light. Very good. Let's do the other one. So right back here, and just follow again. Very good. Very good. Now I want you to focus on my finger right here, and then focus on this light in the back, okay? So finger first. Good. Now focus back here. Good. Now finger again. Good. Now back here again. Good. Okay, I'm just making sure you can switch your focus. Now let's do this side. So focus right here. Good. Now focus on the light. Good. Focus right here. Good. Now focus on the light again. Good. What about up here? Good. Okay. Now focus on this light right here. And tell me how many fingers I'm holding up. Okay? Good. 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 Now same thing, but focus right here. Good. 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 So I want you to just tell me if you can read these letters. Alright? So cover your left eye first. Can you read this line for me? Good. Now what about the next one? Good. And the next one? Good. And then the lowest one. Cover your other eye. Read this line for me. Okay, this one. Good. This one. Good. This one. Good. Okay. And can you tell me what this color is? What about this one? Good. Okay, so your eyes are fine based on those few tests. And have you received a full eye exam recently? Alright, so you're going to want to do that then. Soon. Definitely at least go once a year. Alright, so I'm going to have you just move your head from side to side. Good. Just testing your muscles. Okay. Now, can you push back my hands with your hands? Very good. And now I'm actually going to have you lift this weight for me, okay? So I'm going to just hand it to you. There you go. Now lift with your left. Okay, can you lift to the side? The other side. Good. And now can you just take it and lift it above your head? Okay, good. Alright, perfect. So I can take it back. Thank you. Just testing your strength. And now can I feel your face? Is that okay? Very good. Just going to gently feel for any abnormalities. I don't see anything unusual. Let me just check your skin. Can you look that way for me? Good. Okay, can you look this way? Can you open your mouth for me? Good. Everything looks fine. And then swallow for me. Okay, good. Feels fine. So now I'm going to do a sharpboard dull test. Are you familiar with that? Okay, good. So I'm going to have you close your eyes. Then just tell me if you feel a soft and dull sensation or more of a sharp sensation. I'm going to just put this on the upper parts of your arms, okay? Alright, so sharp or dull? Good. 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 Now I'm switching sides. Good. 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 So no issues feeling those. Now just making sure you feel this on your face, okay? Do you feel that? Do you feel that? Good. You feel that? Good. Do you feel that? Good. Okay. Going to just make sure you can feel a cold sensation. So this is a water globe. It's used for relaxation during facials or massages. So it is a little bit cold. It was in the refrigerator. So I'm just going to place it on different parts of your face and upper arms. And let me know when you feel it. Okay? Okay. Good. 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 No issues feeling? Okay, good. Perfect. So now I'm going to do a few cognitive tests and then we'll be all set. So for this first one, I'm just going to draw a letter on this book. I want you to tell me what letter you see. So you're not going to actually see it in writing, I'm just going to pretend. Alright? So let's start with, let me think. Very good. Now, what about? Good. You can just start naming them as I write them. Good. 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 Now, let's just do a few numbers. So I'm just going to show you some colors. When I move a color close to you, I want you to tell me what color it is. Okay? Let's start with good. Good. Alright, and now the last test. So this is going to be more of a memory test. So I'm going to show you 3 cards, 3 images, and I want you to remember what they are, okay? And these are actually all video games. So remember them, and then I will ask you to repeat them. So, the first one. Two. Three. Can you repeat those 3? Yes. Metroid, Super Mario 3, and Excite Bike. Let's do a few more. Okay, so that was 4. Can you tell me what 4 games you saw? Good, yes. Super Mario 2, Duck Hunt, Mario Brothers, and The Legend of Zelda. And let's do one more. And some of these are just going to be repeats. Okay, do you remember what those were? Good, yes. Metroid, Zelda, Duck Hunt, and Donkey Kong. Very, very good. Alright, so let's see. Let's see if there's anything else I want to test you for today. And how are you feeling right now? So not overwhelmed. Okay. Yeah, I think that is everything. And I'm going to write on this report that you're fine. So no concerns. And I do not feel that you need to come back in anytime soon. Of course, if you do choose to come back in for relaxation purposes, that's absolutely fine. But besides that, you are extremely healthy. So it was so nice seeing you again, and I hope to see you again soon. Take care, and thanks so much for coming in.